The client receiving spironolactone should be avoided so to avoid A. Banana and oranges, B. Whole grain bread, C. Lean chicken, D. Applesauce. So correct answer is C. Bananas and orange because these foods are rich in potassium. So spironolactone already leads to hyperkalemia. So you should avoid banana and oranges. Next question is which statement by a patient taking hydrochlorothiazide indicate the need for further treatment? So means false question. We should touch the utility statement that is false. So I will take this medication in the morning. B. I will stand up slowly to avoid dizziness. I will drink plenty of fruits during the day. I will use a salt substitute instead of table salt. So correct answer is D. Salt substitutes often contain potassium, so there is risk for hyperkalemia. So if it is combined with other potassium sparing factors, so hydrochlorothiazide is so it can lead to hypokalemia. Analysis monitoring a client who received IV furosemide 30 minutes ago. Which finding is most important to report immediately? A. Urine output of 500 ml in 2 hours. That is expected in this case. The blood pressure of 82 by 50 ml of Hg. So definitely that is not expected. C. Potassium level of 3.8 milligrams per liter. That is not bothering. D. Mild ringing in the ears. So mild ringing in the ear that can be assessed. So correct answer is D. Blood pressure of 82 by 50 mmHg. So severe hypertension is a priority. While ototoxicity is also important, but not immediately life-threatening in this scenario. Next question, a nurse is providing teaching to a patient on loop diuretics. So which food should we encourage to prevent complications? So A, cheese, banana, C, bacon, D, white bread. So C and D that is not listed. A also not listed because in this we will give potassium rich foods that help to prevent hypokalemia. So correct answer is B, banana. So next question is a patient prescribed butyrate asks, why do I have to come for regular blood tests? The best response is A, to check your cholesterol levels, to monitor your kidney function and electrolytes, to see if you are losing enough weight, D, to test for drug levels. So correct answer is B. Loop diuretics can cause electrolyte imbalance and affect the kidney functions. Next, which finding in a patient taking spironolactone should be nurse report immediately to a patient to healthcare provider. A. Muscle weakness and irregular pulse. That is very important because it can lead to higher spironolactone hyperkalemia that can lead to arrhythmias. Next, weight loss of 2 pounds in a week. Weight loss of 2 pounds in a week. So that may be important. Weight gain is important and weight loss is not. The increased urination that is expected with this spectrum as diuresis effect. The mild like them, so word mild that will not require immediate report. So correct answer is A. Because these signs are of signs they are of hyperkalemia, so which can lead to arrhythmia. So you have to report immediately. Question number 8. A client on hydrochlorothiazide reports dizziness when standing up. The nurse should advise the client to take the medication at night. No. Increase sodium in the diet. No. That may be. The change position slowly. Well, that correct answer. So they take an extra dose if dizzy. We will not tell the patient to take extra dose. So be out. They take the medication at night that it can lead to bacteria. So A is out. B and C. So in case sodium in diet, so give the questions that the patient is taking hydrochlorothiazide that report dizziness when standing. So correct answer that will be matched with the option C. So change position slowly because to prevent orthostatic hypotension. Next, Which lab value should we nurse monitor the most closely for a patient on furosemide? Furosemide means Lasix loop diuretics. So loop diuretics, it can be release everything so fast. So sodium, that is also product. Potassium, that is also there. The glucose, that will not in the place. Electrolyte, the albumin, that will also not in the list. So we have to choose option A or B. So in this case, we should always choose that answer that is most correct means, that can lead to fill the question more fast. So potassium level, that decreased level of potassium can lead to arrhythmia, so which can lead to heart disease. Hyponatremia also lead to seizures, so that is not as dangerous. Hypothermia. So hypothermia is most common and dangerous. So we will correct the answer B, potassium. Next, a patient on diuretic therapy reports ringing in the ears. So nurse recognize this is as a possible side effect of hydrochlorothiazide, spironolactone, furosemide, D, mannitol. So correct answer is D, furosemide. So high dose of rapid IV push of low diuretics can lead to ototoxicity. The correct answer is C, furosemide. Question number 11. When giving mannitol a patient with increased intracranial pressure, so a nurse should monitor for which adverse effect: A. Pulmonary edema, B. Hypoglycemia, C. Tachycardia, D. Hyperkalemia. So this question is for you, friends. So write down the correct answer in the comment sections. So if you like this video, kindly do subscribe my channel for more tips, and please do share with your friends. And don't forget to like the video. So thanks for watching.